Hi everybody, welcome to my channel Mommy Tales India. मेरा नाम है Amrit, and in today's video we are going to be talking about oral hygiene in maternity and newborn stage. Today we have an expert with us, Dr. Shruti Pandit. Welcome Dr. Shruti on our Mommy Tales India channel.
The pleasure is all mine. Thank you so much.
I'm really glad to have you here. Thank you so much for joining. Friends, I would just like to introduce about Dr. Shruti. Dr. Shruti is a dentist in Thane. She has more than 10 years of experience. She practices in her clinic, Friendly Smile Dental Clinic in Thane, and she's also the member of Indian Dental Association. Thanks, Dr. Shruti, for joining in. What is the top tip that we should keep in mind when we are pregnant as concerned, for our oral hygiene?
So pregnancy brings about a lot of changes in our body. We all are aware of it. Like there are a lot of physical, physiological and emotional. We go through a lot in pregnancy, and in that time, the last thing you want is a bad dental pain or rushing to the dentist at that time. In my practice, I get so many pregnant ladies coming at the last few months, like 7th, 8th, 9th month. I get gynecologists calling me and saying that I'm referring a patient. I'm going to plan a C-sec for her next week. You please do something. She's in terrible pain tonight and she's not able to sleep, because pregnancy aggravates a lot of conditions in us. Like some of them get swelling in their feet, some of them have nausea all throughout the 9 months. Some of the unfortunate people have dental pain in that. So this is because of their pre-existing dental conditions, which they kind of ignored throughout their planning stages, or just being busy with work or some other commitments, that you don't pay attention to dental care. But I would really request all you mothers out there, and you please spread this, that dental hygiene is the most important in pregnancy, because pregnancy related pain, bleeding disorders, bleeding from gums, pregnancy-related wisdom tooth eruption pain comes up. We get a lot of acidity in pregnancy that weakens our enamels, and then comes the sensitivity to cold or hot foods in pregnancy. And also, your oral hygiene is very important when you are handling your newborn, actually. We unconsciously, or we just pass on bacteria from our mouth to them. We have a lot of habits to touch our saliva, and then we touch the baby's nappy, or we touch some tissue or something, and the baby touches that, or we touch some toys, and our people think that डीके पास इज जस्ट ऐसे ही जनरेशन में है, हेरिडिटरी में है, हमारे खानदान में, इसलिए माय टॉडलर नाउ हैज डीके. नो, द पेरेंट्स, देयर इज अ बैक्टीरिया व्हिच इज कॉल्ड स्ट्रेप्टोकोकस म्यूटेंस, व्हिच इज रिस्पांसिबल फॉर caries in everyone, all human beings. Okay, so that bacteria passes through saliva. So suppose you tasted the baby's food ki hot hai ki nahi, and then you feed that baby, or you tasted the bottle, or you touched the bottle, and you have touch that bacteria, that spreads to the child. So it is very important that the primary caregiver, which obviously is the mother in our country, is free from bacteria before her baby is in her hand. For that reason. Second reason, as I said, you don't want unwanted complications in the last planning stages, like the last final stages of your C-section, or the doctor is going to induce you into labor. So, and nowadays we all just very rarely it is like ki chalo ho gaya pregnant, it was an unplanned pregnancy. We all are now this age of woman has everything planned in mind, that this year I will get this job and this degree, and then I will get married, and then I will be pregnant. So when you're planning all this, you know there is a tooth which is decaying since a long time, so it makes sense to go to the dentist and get that out. We get a fitness check done, and we start exercising, and we start doing yoga, prenatal yoga, and everything, that okay, now I'm going to get pregnant, I should lose some weight, or I should start eating healthy. So when you're doing all that, it makes sense you also take care of your oral hygiene, because you don't want unwanted complications in you, and you don't want that infection to pass on to the
So, Dr. Shruti, can you please let us know what is the apt time that we should go for the dental checkup?
So ideally, all dental procedures that you are aware of, that I will need a root canal, or I will need a filling to be done, or I need a cleaning to be done, should be done in your planning stages, when you know you're planning a pregnancy, because that helps a lot. You are relatively free. But just in case it's okay, you missed it prenatal and you are already pregnant, all dental procedures are safe in all 9 months of pregnancy. There is no major risk involved because it's quite safe. But just in case, to be extra cautious, the second trimester of pregnancy or first 3 months are very crucial, right? Even socially, we are very careful for those 3 months. We don't tell people we are pregnant, or we are extra cautious. The doctors also say that first 12 weeks thoda dhyan rakhna. After your 12th week scan is done, you are quite relatively composed that okay, everything is going smooth. So that is the time when you go and get your dental treatment done. The first 3 months you wait because the embryo is just developing, the baby is developing, and you don't want any risk at that formative stages. And also the last 3 months, there are chances of premature contractions or mother going into hypertension or gestational diabetes or whatever. So the last 3 months are also very crucial, right? We don't want early induced labor, we don't want any complications. So the safest window, if you ask me, according to books, is the second trimester of pregnancy. But I have, in the past 10 months, operated on ladies who were pregnant for all 9 months. In fact, there was a panic call that the gynecologist said that she's not sleeping since past 2 nights and I'm planning a C-section tomorrow. Tonight I'm sending to her, please iska daant nikal do, khatam karo. Because uske baad she will not be able to come. She will be having a newborn and she will be in pain after the C-sec and everything. Next 40 days will be very difficult for her to come. उसका दांत आज रात को निकाल दो, कल सुबह मैं उसको सी सेक्शन पे लेने वाली हूँ. So we have that kind of calls also. But as I said, we want to avoid such complications. My own mother, because in those days, like 35 years back, dental was very feared in pregnancy. So my mother says that she was not even allowed to take a simple crocin for the dental pain. She says the reason you are a dentist today may be because throughout those 9 months I was crying in severe pain and nobody let me do anything. वो घरेलू उपचार करवा के 9 महीने चलाए, and after I was born she said she could go to the dentist and remove that tooth. But nowadays it is not like that. It is quite safe. You go to a very experienced and a senior dentist who knows how to handle pregnancy, obviously in consent with your gynecologist, nothing without consulting your gynecologist. If the gynecologist is ready for it, then you can get your treatment done in pregnancy also.